Dr. Erica Wheeler, the PAHO WHO country representative for Trinidad and Tobago and the Dutch Kingdom Islands. Good morning, Dr. Wheeler. Welcome to the program.
Good morning, and thank you.
And let's jump right in. What exactly is meant by the term pandemic when the WHO declares that the coronavirus now is pandemic?
That's a really good question. Now, what it is not, it does not mean that it is severe in the sense that it is more serious than when it was an epidemic. What it does mean is that it's in so many countries at the same time and it's spreading.
Yes.
So it's now been declared a pandemic because of that. The number of countries.
Okay, so that's why it was not, because of the spread before, it was not termed pandemic, it was epidemic.
It was an epidemic.
Right.
Now it's in over 114 countries,
right,
and it's at the same time.
Right.
So it's now a pandemic.
And what does that mean for the ordinary man in the street? What does it mean that they need to take extra precautions? We're seeing things flying through on social media. All of a sudden, you know, it's a pandemic. This is what you need to do. What does the WHO say?
Yes, we should not be more afraid because it's a pandemic, but we should certainly be more prepared.
Yes.
We have been, as WHO and PAHO, saying for several weeks, even since the epidemic started, that we need to take certain precautions in terms of personal hygiene. We need to wash our hands with soap and water. We need to ensure that if we cough or sneeze, that we do it either in a tissue or in the crook of our hands. We need to make sure that if someone is near us and they're coughing or sneezing, that we keep a distance of at least a meter, that's 3 feet. And in general, if you don't have soap and water, which is obviously the most recommended thing, you use hand sanitizer. So it is about observing all of those personal hygiene things that we would do if we have the flu anyway.
Yes.
So it does not mean that, as I said, that COVID-19, the disease itself has become more severe, but we have to be prepared. Personally, countries have to be prepared as well. They need to look at their pandemic influenza plans, make sure that everything is in place so that when the first case arrives, that the health system knows how to respond to it, that there are facilities for isolation and for treatment of any severe cases, because the rate at which people will get it, the case fatality rate is still estimated to be somewhere between 2 and 4%. And remember,
2 and 4%?
Yes.
Because at one point, I've been seeing different statistics. So I saw 0.02, I saw 1%. So you're saying now it is at?
Well, it has been around 2%, but
2%.
It's estimated to be between 2 and 4 because remember, this is a new virus.
Right.
That's why it's called the novel coronavirus. And so we are tracking how it is changing. That's called the etiology of the disease as it goes along. So it's new to everyone. So we don't know everything about it like we know about SARS and MERS that came before, or Hong Kong flu, or swine flu, or H1N1.
Yeah.
So we are learning as we go along. And it is based on what's happened in China, and now we see what's happening in South Korea and in Italy, where they're the highest numbers of cases outside of China. So we're on a learning curve, and we need to be prepared. That's the most important thing, so that also we can track people who are ill as they come into the country, because there are 3 scenarios. There's the scenario of the imported case. There's a scenario of cases in confined situations like we saw in Seattle in a nursing home. So it could be in a nursing home or prison. And then there can be community spread.
Right.
And I think for community spread is where that is why we need to be very, very vigilant about our own hygiene precautions and the distancing. And I know I've seen people bumping elbows and feet and so on. And that is in an effort, I guess people are preparing for it, because we do believe that it is inevitable that it will come to a high number of countries. I cannot say for certainty the whole world. It is possible, but I can't make that prediction right now. But certainly, because of the high degree of mobility in the world and in the Caribbean, because we are countries where we get tourists and other people, there's a high volume of traffic, then of course the likelihood is that we will get it, and we see the cases already
We are
in the
hearing
Caribbean.
a number of calls for essential travel only. What does the World Health Organization recommend in terms of travel?
Well, governments have to make their own decisions, and for persons in Geneva, several people are not traveling. In PAHO, we have not put restrictions on travel, but of course, to those countries where there is an outbreak, we are saying that people need to be cautious about sending persons to those countries, if it is for work or even if it is for pleasure. We should not be going to countries where there are large outbreaks, but we have not announced to the world that, you know, you should not travel anywhere, because countries, sovereign governments, have to make decisions about who comes into their country and who can leave if they have been diagnosed as having COVID-19. But of course, right now we know in Trinidad and Tobago, as far as we're aware, there are no cases.
Is it possible to have a case where persons are presenting with symptoms but don't, but may think that it's the flu and self-cure because they treat themselves, and you know, we have no way of knowing whether they had the coronavirus or not because they didn't present to a medical institution?
Well, yes, it is possible, because there are approximately 80% of people who, when they get COVID-19, it could be a very mild form of the disease. You can have 3 or 4 people and they will exhibit different degrees of symptoms. So it is possible. But of course, fever, dry cough, respiratory problems are the typical signs. For the flu, you have, you know, runny nose. You can have, your body can feel sore, your limbs can feel tired, and so on. But the main symptoms of COVID are the fever, the high fever, the dry cough, and the respiratory problems. So people should educate themselves and know what the typical symptoms of COVID are compared to other symptoms. But yes, it is possible that people may self-medicate, because remember, unlike what you see on social media, everyone who gets it does not die. They don't drop dead.
Which is why we are telling persons not to panic.
Yes.
And in terms of the hysteria now, I have seen a post where persons are saying, and they attribute it to the WHO, so maybe you can clear that up, what you should buy and what you should have at home. And it's a long list of about 50 items almost. You know, it's a similar list to what if there's a hurricane or some sort of natural disaster, in terms of batteries and torchlight and flashlights, and you're thinking, okay, is this for a natural disaster? Are you aware of such a list?
No, well, as far as I'm aware, we have not put out such a list.
Thank you.
Of those. So I can't really speak for where that comes from. We do have all sorts of guidelines for hospitals, for managing cases, you know, for the clinical management, for what happens on a ship, how you treat people. Now we've put out guidelines with UNICEF as well on for children, what you should do in schools, what teachers should do, what administrators should do. So we have a long, long list, you know,
Yes.
30 plus pieces of information that can be used, that not obviously in the form that we put it out, but it can be put in forms that are friendly and easy for people to understand and use. So we have guidelines for everything, but I'm afraid I have never seen such a list.
So you see, this is why it's important to fact check. All these people have been sharing things on social media and taking it as gospel, but really it's important to fact check. Let's talk about cure now, because that conversation has been circulating as to when can we see a cure and why is it taking, well, why would it take as long as it needs to?
Okay, so we estimate that a vaccine would be at least a year, if not a year and a half away. Why? Because it takes time to develop a vaccine that is safe. And you have to conduct what's called clinical trials. And those clinical trials are going on as we speak. There are over 200 clinical trials going on. You start with small numbers of people, and then you expand the numbers of people, because you have to ensure that it is safe when a vaccine is developed. And just let me tell you, the current flu vaccine for H1N1, that flu vaccine changes a little bit every year, because our bodies are living organisms, and so are viruses. So we have to tweak it every year to make sure that it can be as effective as possible. So scientists are working furiously. WHO is part of this, but we have epidemiologists and scientists, researchers from all over the world working on a vaccine as we speak. But it is new. We cannot use the same vaccinations as we have used for previous epidemics, H1N1, for the Hong Kong flu, or for MERS, or for SARS. None of them work. We cannot use antibiotics. Antibiotics are not for viruses, they are for bacteria. You could have what we call a comorbid situation where someone has COVID-19 plus something else that is an infection, and you can use antibiotics, but antibiotics are not effective for viruses. So it takes time. It takes time to develop a vaccine. It does not happen overnight. So that is why it will take time before we have it. That's why we're saying all of these personal hygiene steps are important, and of course government to do its part in ensuring that there's an activated pandemic influenza plan and that hospitals are prepared. Health personnel are trained to know what to do when they get their first case. You have isolation rooms available, you have quarantine available, you know how to what they call triage, which means if someone comes in with a suspected case, how do you channel them through the system? All of those things need to be prepared. The UN itself, the UN country team, is also having a plan for itself as the UN to support the government in this pandemic. So we are doing all that we can to support the government, and we're advising people how to behave in terms of their own personal hygiene.
In terms of the pandemic and the fact that so much hysteria is happening around, and perhaps it could be the way the media has sensationalized it around the world. There are persons who are saying, you have non-communicable diseases with higher rates of higher mortality rates and so on. How do we compare those diseases to the coronavirus, where the mortality rate is 2 to 4%, as you said? And in terms of the numbers of cases, so we're talking about 125,000 or just over 125,000 cases right now in the world, as opposed to, let's say, 300,000 cases. People are talking about whether it's diabetes or cardiac cancer and that sort of thing in terms of in terms of the comparisons. And that's a conversation that keeps coming up, and I wanted to shed light on that from where you sit.
Okay, but talking about a non-communicable disease like diabetes or hypertension, it differs across countries. So we can't say it's a strange comparison. It's a bit like apples and oranges.
Yes, but people have been making that comparison all the time. So I thought we should perhaps clear that up.
Because many non-communicable diseases are lifestyle diseases. So for example, let's talk diabetes. You don't ever have to get diabetes. In my family, there is diabetes, but I can do things to protect myself in terms of how I eat, how I exercise, trying to stay healthy. So those are lifestyle diseases. A virus is not a lifestyle disease. So when you talk about hypertension, diabetes, obesity, and things like that, these are linked to the way human beings live, the way they eat, the things they do with their bodies. So what you put into your body, how you choose to live a healthy life, your diet. So we could never say, yes, I guess we say, like, for example, there's a tsunami of non-communicable diseases in the Caribbean. But what we mean is that the rates are higher than they should be. Yes, there is a greater premature mortality from non-communicable diseases in the Caribbean, in the Americas as a whole, and in the Caribbean, which means more people die than they should between the ages of 30 and 70. When we talk about a virus is no respecter of age, although COVID-19, as we see, it is mostly people who are elderly, especially over 80, but who also have underlying problems of their immune system, such as diabetes, hypertension, respiratory problems. So when we speak non-communicable diseases, we don't really use the word epidemic in the true scientific sense of it, but we do mean in the Caribbean, for example, that a greater number of people are becoming ill or dying from it than should be getting ill or dying. And the numbers per country varies tremendously when we compare even the Caribbean with the rest of the world. This one with a virus, we also have to think of the ability of the health system to deal with cases for a virus. For a lifestyle disease, it is different. You don't have several thousand people all at once falling ill with a non-communicable disease and going to the hospital.
Which is spread out over a period of time.
Spread out over a period, because it takes time. Developing diabetes
But I think some
of
the discussion is that perhaps the same level of attention in terms of media awareness and so on needs to be given to some of these diseases, because it's probably just as critical in terms of death as perhaps coronavirus or COVID-19, particularly for persons over 80, as you said, and some of the young persons.
No, that I will agree with you, that it should be given more prominence, absolutely, simply because they are preventable.
Yes.
You cannot prevent a virus in the sense that you can do everything that you can to keep, yourself, keeping the distances, doing all of the things that I said. But a virus behaves differently from a lifestyle disease. And yes, I do agree 100% that we should give more airtime to what it means to take care of yourself so you don't become diabetic. So if you are diagnosed with hypertension or something like that, what do you do to ensure that you live as healthy and as long a life as possible? My father was a diabetic. He died at 93. So it is not a death sentence either, but we do need to take care of ourselves, because if you do develop diabetes, you can lose a limb. You can use your leg, you can lose your arm, it disqualifies you from working maybe. So you can go blind. There are all these other things that can happen. So yes, we need to be better educated as a population in the Caribbean. And we work on that as PAHO very, very closely with the government. And we know when we talked about priorities for health with the government, non-communicable diseases are at the top.
All right. Well, Dr. Wheeler, I want to thank you so much for coming out this morning to shed some light on this. And the message is not to panic.
Yes.
Yes, and to take all the measures with regard to washing of your hands. And one quick question before I let you go. Hand sanitizers, we've been seeing again, I want to because it's so much of information sharing on social media. We've been seeing all these recipes to make homemade hand sanitizers. What does the WHO say to some of these?
We have not given out any information on how to develop hand sanitizers. I think you can go online to WHO and research what they say about it, but we are saying use hand sanitizers if you don't have soap and water. Please use soap and water. If your hands are dirty, that's what you do. That's what you should do. You should use soap and water. But yes, you can have your hand sanitizer. There is a certain proportion of alcohol that you need to have in a hand sanitizer for it to be effective. But my advice to you is, in all things COVID-19, please go to the reputable websites. You have the Ministry of Health website here that's giving information. You have PAHO and you have WHO. And people should be encouraged not to do DIY.
Unless it's Carrie, of course, right here when he does his DIY with the woodwork on the show. Yes. Thank you so much, Dr. Wheeler. Dr. Erica Wheeler, PAHO WHO Country Representative, Trinidad and Tobago and the Dutch Kingdom Islands. This